My name is Robin, and today I am talking with Dr. Joseph Hayes. He is the Chief Medical Officer of Omni Family Health, and he's here today to tell us a little bit more about the health homes programs and clinics that Omni has. Hi.
Hi.
So what exactly is the HHP?
So the health home programs are an attempt to deliver high quality and high value medicine to save as much money as possible in the healthcare system. You know, we know that 50% of healthcare expenditures are incurred by 5% of the population.
Yeah.
And so identifying that 5% and giving them more intense care with case management to try to save some of those dollars.
And so how long have you guys been doing this?
We started our first HHP clinic in 2017.
And so that means that you've been like during some dire times, you've really actually been helping out people a lot then.
Yes.
Yeah.
Yeah.
And how many locations are there?
For HHP, we have two. That first site that opened in 2017 is in Oildale, and that's our more mature site. And then we just opened a new site in Shafter.
That's awesome. I believe I've passed by that one in Shafter too. But yeah, you're helping people out because, I mean, I can't imagine. Well, no, I can't imagine because I was there at some point, you know, and I just looking at your bills or looking at what you need to get done, but worrying about what is this going to cost? Because some people don't take care of themselves because they're like, I can't pay for that.
Absolutely. And then they end up in a situation where their healthcare costs are higher. So the HHP program, when we originally started it, we did it in collaboration with Kern Health Systems. And so we got a lot of referrals directly from them of people that they wanted to be managed more intensively. But then also other providers in one of our other 32 clinics could also refer people who met certain criteria.
And what is that criteria then?
Well, that they have, mainly that they've had 2 or more chronic diseases. And what we're really looking for is also people who've had a hospitalization, who've been to the ER a few times, because that's where we can really make a difference is in preventing those rehospitalizations, and preventing those ER visits.
And especially probably with older individuals too.
Well, many of the people who have, 2 chronic diseases are older individuals. Yeah. Probably the most common is that we see people who have diabetes and hypertension, and then they develop, kidney failure. Or they have peripheral vascular disease and are losing limbs or getting infections. So, those kinds of patients can end up just kind of snowballing their problems.
Yeah, that is a good way of putting it. And I know there are a lot of people in Kern County who actually are suffering from the problems of diabetes, for instance, and hypertension. And I do know of some individuals who put it off because they're like, well, I can't afford those pills. I can't afford my insulin. But then it leads to one thing, to another thing, to another thing.
Right.
Yeah.
And, as a federally qualified health center, those are the patients that we want to see even in our regular clinics. Those are the people that it's our mission to take care of. And we take that mission really seriously. And, we are really committed to making sure that no matter what your means, that if you come to one of our clinics, it's going to be beautiful. You're going to be greeted well.
Yeah.
It's going to be a good experience for you.
So how would you fix the transportation issue? Because I was going to ask about that.
Yeah. So, many of the managed Medicare plans like Kern Health Systems, they will pay for transportation to your doctor's visit.
That's wonderful.
Yeah. Sometimes people don't know. And so it's often, a great thing that we can break the news. Hey, you know what? They'll pay for you to get here.
That's awesome. I love that. And you were saying before, like, it doesn't matter what the means is. So is there like a financial situation that they might have to be in to qualify for this sort of thing?
To qualify for HHP, no. To qualify for Medi-Cal, there is. So most of the people who are there are in a Medi-Cal managed care plan, and so they've qualified for that. But as a federally qualified health center, what we don't want to do is turn anybody away.
Right.
We want to take care of people even if they have nothing.
Yeah.
So we have a sliding scale. And if you are below the poverty level, may be possible for us to give you care for free. And if you are, above the poverty level, but up to say 200% of the poverty limit, we have a sliding scale where you just pay a nominal fee to get your care. We like to think of most of our sites as one-stop shops.
Mm-hmm.
There's medical care. We have dental care in many of our offices. We have behavioral health. We have psychiatrists. We have LCSWs who do therapy. And we have OBGYNs who do prenatal care and postnatal care for our patients. And we even have some areas where we have specialists who give some of their time to come in maybe once a month and see some of our patients. So you can get all those different kinds of care. And we also have pharmacies in several of our sites.
Yes, very conveniently located.
Yes.
Yeah.
And even if it's not conveniently located for you where we have a pharmacy, we have free home delivery to most of our service areas.
And I see him glowing saying this right now because he knows that is a big deal. Like, I don't want to go to the pharmacy today. Can't I just get my pills sent to me?
Absolutely.
Yes.
And in many cases, we do it same day. So you see your doctor in the morning, you go home, and a bit later somebody rings your doorbell and says, your medicine's here. We try to kind of have that Omni spirit, throughout. And when I'm in the clinics, I like to remind people that, no matter what you do for this organization, it's about patient care.
And so if anybody wanted to get more information about any of this, how could they contact you?
So, what I'd recommend is that you call Omni, 1-800-300-OMNI, and that you make an appointment and come in and see one of our providers, and then talk to that provider about whether you'd be an appropriate person for them to send over to the HHP program.
Yeah, that's actually a good idea. And I know that it's a phone number where they can, I hate saying it's like Pizza Hut. I hate saying that, or Domino's, but it's like, a pizza place where it's like, there's this person there, they're the operator, but they were like, oh, let me find it that's local to you, that's closest to you. And it's super convenient. Yes. Super convenient. So yes. I think you guys are just doing great stuff. That's amazing.
I appreciate that.
Thank you. I mean, is there anything else you wanted to add?
I think that one of the benefits to having our own pharmacy and an FQHC is that we can take advantage of special pricing for medications. And so very often we're able to get affordable medications for people that they were not able to get otherwise. I'm a guy who's practiced medicine for 30 years.
Yeah.
And, fairly recently went to business school and started doing this managing stuff, which I really love because it used to be one patient at a time. And now I can hopefully make life better for a whole bunch of people at a time.
Yeah, I think I'm proud of you because you wanted to go to business school to do better in the world.
Yes.
Not to just rake in the dough. You can't see money fingers.
Absolutely. I went to USC, Marshall School of Business. Fight on.
See? You got a good one. Yeah, I mean, Omni has been around for 40 years doing amazing things. OmniFamilyHealth.org.
Yes.
I always say emphasis on family because, again, I really do appreciate the resources that you guys provide for women because it's very, very important.
Well, another thing that's going to happen is that we're looking at, the rate of pap smears and mammograms, and we're going to be trying to do some special weekend clinics to try to give more women the opportunity to get in and get caught up with all of that preventive care that really saves lives.
Yeah, I mean, if you're working like a long day full-time job or 2 full-time jobs, depending on the situation, by Saturday sometimes you're like, well, is it open? I don't know. So I think that is awesome. That is very convenient.
Yeah, several of our clinics have regular Saturday hours, and we also have late hours at least one night of the week at most of our clinics. So we'll go to 7 or 8 o'clock to let people get in after work.
Yeah, it's perfect. Yeah, it's great. It's a great system you guys have worked out, and I'm really happy that you guys are doing this. And hopefully you'll be able to open up some more of those clinics soon coming up, because, I mean, it's a big deal, man. In Kern County, that is a huge deal. So
we always have our eyes on places that might be a good site for the next clinic.
That's right. And if you have any questions about the Health Homes programs clinics in Kern County from Omni Health, again, go to omnifamilyhealth.org or give them a call at
1-800-300-OMNI.
Easy. So omnipresent. Dr. Hayes, thank you so much. I really appreciate you coming in today.
Thank you. It's been fun.